Good evening. So let me start today with a question. Which is a faculty or which expert all of us have seen, all of us have visited to at some point in time in our life? Even if we go back to our childhood, which is a doctor, which specialty we have always visited? I'll come to the answer, but before that, yes, I am Dr. Bhavna B. Shinde. I am here with the episode number 9 of Autism docTalk, wherein we interact with the who's who of autism care, those who cater to autistic individuals and their caregivers. Okay, so let me, yes. Okay, so this is the platform, Autism docTalk. I am your host. Mandatory disclaimer says that this is not a individual medical advice, and whatever your health related issues are, those to be sorted out with your own medical practitioner. Answer to the question is those are dentists. We all have seen dentists, be it is during our childhood, middle age, or the later years of life that we are going to see, of course. So today we are in conversation with Dr. Kaustubh Kolge. Dr. Kaustubh has done his MDS in pediatric and preventive dentistry. Currently, he works as a consultant pediatric dentist. He, again, one of our guests who has been internationally experienced. He had been to Oman, he had been to UAE, and currently he serves in Thane as consultant pediatric dentist in Jupiter Hospital and Mala Newborn Hospital. There are many affiliations, and the areas of his interest are here uh, on this particular slide. But what is of my interest is Dr. Kaustubh has already been catering to children of special needs, children with special needs. So, without a further ado, let me welcome Dr. Kaustubh. Hi, Dr. Kaustubh. Good evening.
Good evening. How are you?
All is well. What is this setup? And I am quite impressed with the kind of lighting you have.
So actually, this is my clinic. This is where I practice my pediatric dentistry. And what you are actually seeing are special lights which we use for certain children who are sensitive to bright lights. So these are lights which help them calm or they soothe the child, and it doesn't look like a place which is very bright. So mainly for children who don't like too much of light, this is a perfect setup which we have actually made up so that we can cater to all kind of children who come to us.
Oh my God, this is very, very, very impressive. I tell you a story, may not be mine. One of our children, autistic children, had visited a dentist clinic. Even I am not comfortable with the kind of lighting they have, very flashy lighting on the over the chair.
Yes.
So our children are definitely some of the children, they are not comfortable with this kind of lightings. My child, he doesn't like it, or kind of aversion for him. So I really like the idea where you set your clinic in a way which is kind of autism friendly, especially for children who have kind of problem with the lighting. So thank you so much, Dr. Kaustubh. I understand that, and I know that you have been quite busy throughout the day, but still you managed to give some time for this platform, and this is definitely going to help us because you are the first pediatric dentist on our platform. So I have a lot of questions for you. So be ready with this.
Sure.
The first
Let's go.
question for
Yes,
me,
yes.
yes, yes. So first question would be, when should our children autistic, so everything today is going to be about autistic children. So when should our children visit a dentist?
See, that's a wonderful question because that question, I think it can be a general question for any child. As you know, for or as many people know, that autism is not something which you know that the child has at birth, correct? We come to know later. But the questions which many of my patients' parents ask me, "Hey, when should we bring the child to the dentist?" It is a
Yeah.
very important question because if you start early and if you start at a time when the problems have not even started, it is the best thing to do because at that time I can tell the parents or we can take care of the teeth before the problems start. So preventive dentistry comes there where as early as possible. So according to whatever the textbooks or whatever the articles say,
Yes.
6 months of age or before the first birthday is what you should take your child for a regular dental checkup. So if you take the child at that time, it will really help the parents gain a lot of knowledge about how to take care of teeth. So if you take care, there will be no problem. So the answer is as early as possible before the first birthday or on the first birthday as a gift to the child to go and do a dental checkup. That is the best thing to do.
Yes, yes. Even I, okay, so that made me realize that I had not taken my child for a dentist, the dental checkup. But definitely, that's a good take-home message for all other parents that before the child completes his first year of life, he or she should see a dentist. Doctor, that leads me to ask a question further is there any difference between the occurrence of various dental conditions among neurotypical children and autistic children? I mean, what I'm trying to ask is, are there
Hmm.
any particular dental conditions which occur more in autistic children, which parents have to be wary of?
See, actually, no, because as such, all children, there is no difference. But the problem in children with autism in particular is that they have different ways of having food. Like what I know or what I have seen is many children, they like to have soft food. They like to have food which is sweetened. They like to pouch the food. They don't chew very well because they are not able to chew that well. So the food remains in the mouth for a longer time. So because of that, what happens is the chances of having cavities increase.
Yeah.
So that's the thing because of which the prevalence of cavities in autistic children is more, and also periodontal conditions because we are not able to brush the teeth well or we are not able to brush the way we are supposed to brush. So the chances of gum infection or gum inflammation also increases. So these two conditions are more prevalent in these children, and that's why again to the first point, as early as possible, if we try to get the child used to taking care of his mouth or her mouth in the right way, these conditions will not come.
Yes, I can relate to the point where you said that some of the children, they keep food in the mouth for a long time. Even my son Kaisar, he has oral sensory issues. So
Okay.
he stuff food in his mouth and he keeps it at
Yes.
times. He keeps it in the mouth for a long time. So
Hmm.
I can understand that. And okay, so as you mentioned that there is not a particular difference between among the neurotypical kids and the autistic kids in terms of occurrence of dental conditions. So, doctor, I wanted to understand this thing since you have been taking care of autistic children in your dental OPD for quite a long time now. So, what things are you doing differently for the
That's
special kids?
that's a question which have lots of answers. So
Yeah.
it starts with knowing the child. To put it very straightforward, uh, to know what the child does, to know what the child has gone through, to know what the likes of the child are, to know what the dislikes of the child are. So, frankly, before you even want to do a dental visit, this is after 3 or 4 years of age. because you have not been visiting the dentist from the time he was small. He doesn't know me, correct? So
Hmm.
again, the answer, I'm sorry, I'm coming back to the first point again because I want to prove that if you start early and if you start taking the child from the time he's small, he will know me well or she will know me well. And once they know me well, they will not
Absolutely.
want to not come to me. You understand? That's the reason start
Yeah.
early. Okay, but in some cases that doesn't happen. So if the child is coming to me, I need to know what the child likes, what the child dislikes, what are the problems that he's facing, what are the medications that he is taking, what does he like, what time is good for him, when does he sleep, when is he fresh, what is he aversive to, does he like lights, is he aversive to certain smells, is he aversive to touching, does he like strangers, does he make eye contact, does he speak, is he verbal, non-verbal? So there are many things which we need to know before we plan out what we need to do. So it's not good to just get a child and do a checkup because these things, if we know at the start, they will definitely help us plan and then take the treatment forward. So what we usually do is we talk to the parent. So when the parent calls us to take an appointment and we come to know about this history of autism, then we have a chart or we have a questionnaire which we send to them, which they usually fill
Okay.
up. They send it back to us so that we know in detail what is happening, what all is happening. So we are ready from our side. Then we get back to them, we let them know, okay, okay, these are the things and this is how we should go about.
Sorry to interrupt you here, doctor, because I found this very interesting that you have a questionnaire ready for
Yes,
our children, children with autism.
yes,
So I'm
yes.
quite curious what kind of questions you have in those. So if you can
The
give
same
few
ones,
examples.
few examples, same like what is the child verbal or not? First,
Okay.
is does the child understand? Does the child communicate? Is the child able to understand? Does he understand few words? Is he aversive to lights? Is he aversive to certain smells? These are the basic questions which we ask. So we are ready. So when the child is here, it should not be like I don't know anything about him. It should be like I know everything about him, and then I already have a plan in my mind, and that makes it go very smooth, and it is a better way of carrying forward an appointment.
Wow, it sounds interesting. Interesting. As a parent, I have not come across uh, any such questionnaire, unfortunately, from the doctors I had visited to. And for the viewers, I have not visited Dr. Kaustubh Kolge as of now. Sir, again, bringing you back to where you had been explaining about the setup, special setup you have. The questionnaire part, take and impressed. Next.
Next comes the questionnaire. We come to know we plan an appointment. Now the planning of appointment is very important. Usually the first appointment. Why the first appointment? Because we all are fresh. The child is fresh. The parents are fresh. We are ready. Being fresh is very important because we need to give that extra bit of energy. We need to give that extra bit of time for that appointment where there should be no disturbance. So I usually give the first appointment or maybe the last appointment, but I prefer the first appointment when we all are fresh. And I give a 1 hour appointment even if it is the first appointment. With usually in the first appointment we don't do much. It's mainly letting the child come, let him get acclimatized with our environment, let him understand what is happening here. We are not even talking about dentistry on the first appointment. So it's like he's coming, he's sitting here. It's like a play area. We have a small play area outside. We have some toys here which we show the
Wow.
child. So they come inside. Inside also there are toys. We don't even talk about dentistry because I believe more than telling the child that we need to go and visit a dentist, it is important let him come and visit me as an uncle whom I need to visit. So, like a friend of your mother or a friend of your father, sit here, have a talk, let him observe because children observe and children observe everything. So, any kind of
Yes.
body language which is not very good, they immediately pick it up. So for them, it is important that we are like normal human beings, like we talk to each other, we greet each other, let him observe. In between, I try to talk to him or try to ask some questions. So keeping it calm and keeping it normal is very important in the first visit. In the after the first visit, most of the times I don't do much. That is my way of working. I am not against anyone who does other ways, but first appointments, frankly, I don't even do a checkup. I know many people will be surprised why this, but that is a very good head start for me, because that makes the child sure that this is a place which is not going to harm me. This is a place where nothing happened without my consent. So that
Yes.
is the first appointment. That is a very important appointment, after which within the next 2 3 days, as early as possible, because the child doesn't remember for too long, so within the next 2 3 days the second appointment is scheduled, and then second appointment, then we take it from there. Now there are many things in this, like I know the time is not too much with us, but then each and every child is different. So as I said, with the questionnaire we know what all are the likes, dislikes, and whatever we have spoken about, and according to that we go forward. Now, treating each child is not going to be similar or easy or difficult, because every child has a different way of, you know it very well. So, for example, if the child comes on the second appointment, we usually try to make the mother sit on the chair first, seeing
Oh,
that we do the checkup of the mother, let the child be around, let him see that what I'm doing, the mother is happy and laughing. Because we make the mother laugh or let her smile that after this I felt good, then the child sees that. Then maybe
let
ask
me
or
let
request the child.
excuse me. Let me
Yeah,
let
yeah,
me
sure.
stop you then and there, because I am going to ask this phenomenal question, the boogeyman question about the examination on the chair. But before that, I really liked couple of points what you said about that giving the first appointment. So
Yes,
because that also subsides the waiting anxiety of children. So what
yes,
they, so when they have to wait in the waiting area along with all other people around, so that might
yes,
create an anxiety in them. At least in
definitely,
my son, that's a anxious situation. So
definitely.
that's kind of relief for parents as well as for the child too, because ultimately when you go to the doctor there should be with a purpose. Sorry, most of us do not go for the preventive kind of, and we are learning
Yes,
that. But
yes,
when there is a problem we go to the doctor,
correct.
and if the child is not in a zone where he allows the doctor to examine, then that's that won't be the fruitful visit. I
Yes,
mean, if he's irritable and not letting anyone touch, or he is afraid of the area, or he develops phobia for that place, for that person, for that surrounding, then it becomes extremely difficult. So I am
correct.
quite impressed when you said that you prefer either the first or last appointments. So that definitely
Definitely,
going to
for
help
sure.
us. Yes.
And as you
Yes.
made a good point, doctor, when the child is coming, there is no one else in the waiting area. So it's just him.
Yes.
We make sure
Correct.
of that, that there is no one else. We work only on appointments. And when it is a special child coming, we make sure that there is no one else. It is only for him. And we don't even make him feel that he's come to a dental clinic. So that is what I'm trying to say. So that
And
automatically makes him quite cool, and that, it becomes easier for him to accept it, I feel.
yes, and the other a beautiful point which you mentioned about that the child understands that nothing is going to be done without his consent. So
Yes,
when the child feels the control over the situation, that makes him calmer. When the things,
yes,
when he perceives that things are out of his control, that can induce anxiety in him. And that's
exactly.
such a beautiful point you have mentioned, that once the child realizes that nothing is out of his control, he can have a control to everything around him,
Yes,
everyone around him. So that's
yes.
very good points. So
Yeah.
doctor, now coming to the boogeyman question,
Hmm.
dental examination. To be honest, even I am not very comfortable when the instruments are, so that
No
mirror
one is,
thing.
even I am not actually.
So okay, I'm not the only one. So for, I can give you one of the examples. When Kaiser was very young, we took him to the dentist. I mentioned about the lighting wala thing, where he wasn't comfortable, and other thing was he was trying to explore the sink and the instruments, and the moment he saw that instrument, I think it was a mirror or something, so that was, he saw it and he jumped off the chair and ran away. So what
So why
measures do
did
you
this
take?
happen? So why did this happen? So I always ask questions, why did this happen? Because it was there lying in front of him, which he thought will hurt me. So that's why when the first day they come, we don't have any instruments on top of the table. We don't have anything which he will feel that it's going to hurt him. But obviously, this is the first sitting. Second sitting, obviously, some examination has to be done. Now, in this, there are two parts. There are children who can still communicate, children who can still understand, and there are children who cannot communicate at all. There are children who cannot understand at all, or there is no way for me to make them understand. So, there are different ways of handling both of them. Now, what happens with children whom we cannot communicate at all with, or children who are completely non-verbal, or children who have a kind of disability which doesn't allow them to speak to us or communicate with us normally. With such
Yes.
children, it is very important that we take a look inside the mouth, even if it is for a brief moment of 5 to 10 seconds. I understand it is difficult, but then being with the mother or sitting with the mother or sitting on the lap of the mother makes it easier so that at least the mother is holding the child feels comfortable in that way. And even if he's not able to open the mouth a little bit, by showing him or by doing certain things to him or giving the mirror to him in his hand and then taking it from there, it makes a difference. See, I'll be very frank, doctor. It's not a single thing which applies to every child. That is my first and foremost thing which I've told you. So, a child like yours, for example, might not like a mirror. The other one might like a mirror. We don't know because they have never seen a mirror. So, they don't know what this is going to do to you. So, that's why before that stage comes, the first stage is important. So, first visit makes a difference. Second visit, also, we don't rush immediately. I just want to take a look at your teeth. It might be without a mirror as well. So it might be just open your, then same thing what we did in the first sitting. Let mama sit there. Let me check mama's mouth. I am opening your mouth. I'm checking your teeth. Show it to him that I'm doing this to mama and mama is laughing. Mama is happy. Mama is very happy after doing this. Then I give the mirror to the mother and let her check his teeth. Then once he's a little comfortable with that, then it comes to me if he's okay with it. If he's not, it's okay. At that moment, it will go to the third sitting. See, patience is the key here. If patience is not there, you cannot do good with the child because at the end, a good rapport with the child is very important. If you don't have a proper rapport, a thing can go very bad at any instance, as you said. One small mistake or one small wrong thing which we do, and everything is spoiled. So second sitting also, if possible, examination. If he's letting us examining, very good. We make a note of it. Taking X-rays also very much possible if he's able to open the mouth, get it done as
Yes.
soon as possible. If no, it will go to the third sitting as well. So we are ready to do three. I have done 3 to 4 sittings of a patient who was not even sitting on the chair, which is fine, which is okay. It's like a normal thing. It's fine. We cannot make expect them to understand or understand whatever we are trying to say. But touch wood, till now, it has never happened that I have not examined the child. So it might take time, but I have definitely examined at least once. Sometimes not very willingly, but most of the times the child does open once he knows that this uncle is not going to harm me. So that is how it works.
Yes, perfect, perfect. So those are quite interesting points where you mentioned that you let the mother, I mean, you examine the mother first, kind of modeling, and
Yes.
once the child sees that there is no danger in doing that procedure or the examination part, so he might feel comfortable. The second, when you said that you ask mother to kind of examine with the mirror or whatever tools you're going to require, so that would definitely subside the anxiety or the perception of danger in their mind. So that is definitely going to help with this. Doctor, I would like to ask you certain questions related to, as you understand that your setup is autism friendly, but other dentists, they might not have the kind of setup, or they, most of them are willing, most of them are very patient, and they want to work with the children with autism. So what kind of message or what tips would you like to give to them?
The first and the most important tip is patience. Second is
Yes.
empathy, and third is respect. I think these three words sums it all up. So patience, empathy, and respect. If you have these three with you, and if you are really willing to work with the child, only then actually go into any kind of child dentistry. If you have these three things with you, I think you can easily manage any child. I don't think it is going to be difficult.
Wow, that's very powerful. So when you said patience, empathy, and third point I missed is respect. Yes,
Respect. Yes.
respect for the caregivers as well.
Definitely,
Because
but then these things do matter. Respect towards the child, that the child is because what he is, but having that respect is very important.
yes,
And these things should be there within you. So I am not against anyone not checking a special child, or I'm not against anyone not doing pediatric dentistry. But I think these are the prerequisites which are very important if you want to be successful in doing pediatric dentistry.
correct, correct. I absolutely agree with you that there are certain aspects which can be worked upon as a infrastructure basis, as you have done at your clinic, and as well as perception. So if
When these
someone,
one more point, just to disturb you, these 3 points, if you have, you will work towards making your clinic better. You will make work towards getting the right appointment. You will work towards having the trained staff. You will work towards having the
yes,
right equipment. So that's why. So it starts from these three things. So if you have these things, other things will follow. If you don't have these three things, other things are not going to work for you. That is what I believe.
no, no, perfect, perfect. So thank you so much for this particular points, and I'm sure that this is going to help many of our dentists who really are into catering to autistic children. So I am almost at the last section where I would like to understand your take or your message or tips to the caregivers who are taking their children to the dentist. So what should they be ready with, or whatever you want to talk about.
So you're talking about parents, or you're talking about the healthcare workers?
Caregivers, parents.
Parents, right?
Parents, yes.
So So first of all, be positive. The parents themselves are scared. Like you said, you are scared to visit a dentist, correct? And your child immediately understands that by body language. Please remember and trust
Yes.
me on this. So the fear has to go away from you first. That
Yes.
how will he cope? What will they do? Will the situation be good? Will he create a ruckus there? Will it be difficult? These negative questions, throw them down the bin. Think positive. Prepare the child. Let the child know, as I said, that we are going to meet my friend. That's all you need to tell. You yourself have to understand. Sometimes you even ask the parents to come and meet me before the child comes to me. That is a good
Okay.
thing, because if the parents come and meet me, I can actually come to know everything, even if the questionnaire is not answered. When I talk in person with the parent, it's much easier. So we know, and that time we can tell the parent, this is what you need to do. You be normal, be relaxed. Get him to visit me as a friend of yours. Let him come, let him understand, let us talk, and then we take it from there.
Yes, surely, surely this would help to the parents. And one more point I would like to add from my side is prepare the child beforehand. So once the child is at home, if the parents prepare the child mentally, so this is going to be the thing, or that they are going to open your mouth, that thing is going to be put in your mouth. So if the child is prepared beforehand, so that would also help curb his anxiety. So that's something
I'm
I
not
would like
very
to know.
sure. I'm sorry, I'm not wanting to go against you. But we try to
No,
do
no,
something
perfect,
good
perfect.
for
Leave it as
our
it is.
child. We try to do something good for our child. We want him to be prepared. But then telling him about things which he doesn't know, which he can only imagine, can actually backfire. Because you are telling him that he will open your mouth, you're telling him he will not hurt. But more important, better than that is just get him without telling him that we're visiting a dentist. I think that is better. And then here, when he sees you opening the mouth, then he will open the mouth better. Because you are telling him he will open the mouth, then he's thinking, what is he going to do inside my mouth? What is his interest in my mouth? So, nothing against things which have been
Yeah, yeah.
told or taught. This is my own experience. I prefer not telling children things which are not required. Let dentistry happen in the place where dentistry happens. At home, don't talk about dentistry. That is the best thing to do.
Okay, you have added another perspective, and that's good. We have two different perspective, and I completely agree with you what you said.
And I respect you, huh? Please don't feel this. This is
No,
my
no,
point.
no, no,
This
not
is my
not not
point
at
of
all.
view.
Not at all. I completely understand. So what works for my child may not work for all other children.
Exactly.
Right.
Yes. Perfect.
Yes, yes,
Yes.
yes. I understand that. So the last question I have, rather question, is closing remark, because today we have learned a lot on how to set up a clinic, or what should be the perspective towards the kids, and many other things we learn through you. And definitely our dentists, our caregivers, parents and therapists are going to get something out of this. So thank you so much, doctor, for this. Any closing remark? And if someone wants to contact you, online consultation or whatever consultation, so where should they be contacting you?
Uh, you can get in touch with me. What I can do is I will share my number and the email address with you. You can just put it down with our presentation. I think that will be great. And I'm ready
Yeah.
to talk because every parent will have different queries. Every parent will have different worries. Every child will be different. But
Yes.
more than talking on the phone, it is better if you can talk in person without the child in the first meeting. That is how it works. So you can actually
Yes.
talk to me. You can definitely contact me. You can mail me anytime, no problem at all. And my last remark is this is not the end of it. This is just the tip of the iceberg. There are many
Yes.
things related, how we take care, what you should do. And if you want me to talk, the last thing, it is going to be the first thing which I said, preventive. If you start early, children will not have problems. They will know me from the start. They will know me as a good person. They will be ready to come and do checkups. All the other problems are solved. And that is how it works.
Yes. And this is very helpful. With this, sir, I already have taken a lot of time of yours. So thank you so much. Thank you for being on the platform for our kids. Thank you so much.
Thank you so much for having me. I'm very happy to be a part of this platform and I'm ready to help anytime. It was a pleasure
Thank,
being on this platform.
thank you. Thank you.